Hey, I'm Luke Schellenberger. I'm an ENT doc. So today we're going to be talking about halitosis. Halitosis, a lot of people have bad breath. And so a lot of times patients come in and see me, say, what can I do about my bad breath? Well, not all halitosis is an ENT problem. Oftentimes it's a dental issue. There's a lot of patients who don't take very good care of their teeth, and their bad teeth lead to bad breath. But if patients are taking good care of their teeth, they've been to their dentist, the dentist says, look, your teeth look great. Sometimes it can be a GI issue, but I would say more often than that, if it's not your teeth, it is an ENT problem. And the problem's in the tonsils. And so tonsils sit at the back of the throat. There's two of them there. And the problem with tonsils is that they can get pockets in them. These are what are called cryptic tonsils. So here's a picture of a cryptic tonsil that I've made. And basically, cryptic tonsils have little pockets in them, little caves. And some of the caves are superficial, and bacteria and debris and dead tissue that our body makes can get in those little pockets and will eventually kick them out. And sometimes patients say, I like cough up these really foul tasting looking seeds occasionally. They kind of look like tiny little grains of rice, but they are not grains of rice, they're nasty. That's called cryptic debris or tonsillitis, if you want to sound kind of smart. The problem with the tonsils aren't those superficial caves, it's the deeper ones. And so bacteria can latch on to this kind of basically dead tissue and dead skin cells. They're actually mucosal cells that are shed, but they cannot get out. And so if they can't get out, they just sit there, fester and rot. And so you have this basically a kind of chronically festering, rotting, dead tissue in your mouth. Isn't that awesome? And so the good news is there's some relatively easy things we can do about it. I have seen patients use water picks, and I've encouraged patients to kind of water pick to try to clean this stuff away. That works sometimes. And then there are patients that say, look, I've tried that, it's not worked, and we do think about tonsillectomy. Now, tonsillectomy is not for the faint of heart. It can be a pretty tough recovery for adults, but is it extremely effective when there's that cryptic tonsillar debris that's the cause of the bad breath? So if you've got bad breath, you've been through the dentist, it's not a GI issue that's obvious, and you have those occasional tonsillitis, first start out with a water pick. It's not that hard to do. You just kind of add it to your normal routine. Hey, I brush my teeth in the morning, and a floss, and then I water pick my tonsils. Easy thing to do. But if that's not cutting it, still really frustrated, and you recognize, hey, I'm ready to have, a tonsillectomy. I'm ready to have that tougher recovery. Again, rough week and a half, or even sometimes 2 weeks. It's extremely effective. You just got to weigh the benefits of not having bad breath versus having a tough recovery. So come and see me, all right?